Febrile seizures is an pediatric disease condition. Look at this picture, shows that febrile seizure in different phases. Then EEG, electroencephalography for diagnosis. Then neural imaging, CT, MRI. If focal seizures or neurological abnormalities exist. A detail going on. Introduction. Febrile seizures are convulsions triggered by fever in young children, usually between 6 months and 5 years of age. These seizures occur without a underlying neurological condition and are often benign, though they can be distressing for parents and caregivers. A definition. Febrile seizure is a seizure associated with fever, temperature above 38 degrees Celsius or 100.4 degree Fahrenheit in children without an intracranial infection, metabolic imbalance. Etymology. The term febrile is derived from the Latin word febris, meaning fever, indicating its association with elevated body temperature. Seizures comes from the Old French seizure, meaning to take hold or grasp, reflecting the sudden, involuntary convulsions. Characteristics of the condition. Types. Febrile seizures are classified into two types. A. Simple febrile seizures. 1. Last less than 15 minutes. 2. Occur once in 24 hours. 3. Generalized, affects the whole body. 4. No neurological defects post seizure. B. Complex febrile seizures. 1. Last more than 50 minutes. 2. Occurred more than one within 24 hours. 3. May be focal, affecting one side of the body. 4. Higher risk of future epilepsy. Causes. 1. Viral or bacterial infections. Example influenza, roseola. 2. Post vaccination fever. After DTP, MMR. 3. Genetic predisposition. 4. Environmental factors. Sudden fever spikes. Risk factors. 1. Age common between 6 months and 5 years. 2. Family history higher risk if parents or siblings had febrile seizures. 3. Rapid temperature rise sudden increase in body temperature. 4. Infections viral infections are common triggers. 5. Low sodium levels. Complications. 1. Recurrence. 30 to 40 percentage of children experience another febrile seizure. 2. Risk of epilepsy. Small percentage, 2 to 7 percentage may develop epilepsy later. 3. Prolonged seizures. Status epilepticus. Seizures lasting more than 30 minutes. 4. Injury due to falls or uncontrolled movements. 5. Parental anxiety and stress. Pathophysiology. The fever increases neuronal excitability by affecting ion channels, neurotransmitter balance. In genetically susceptible children, this leads to excessive brain activity, resulting in seizures. Immature nervous system in young children make them more vulnerable. Pathophysiology of febrile seizures step by step process. First step fever trigger a rapid rise in body temperature, usually above 30 degrees Celsius or 100.4 degree Fahrenheit, occurs due to infections, viral or bacterial, or post vaccination reactions. 2. Immature brain susceptibility in young children 6 months to 5 years. The brain is still developing, making neurons more excitable and prone to abnormal electrical activity. 3. Hyperthermia induced neuronal excitability. Fever alters ion channel function, especially sodium and calcium channels, leading to increased neuronal depolarization. Elevated temperature affects inhibitory neurotransmitters like GABA. reducing its calming effects on neurons. 4. Excessive neuronal firing. Hyper excitable neurons generate excessive synchronized electrical discharges in the brain. If the abnormal firing is widespread, it results in generalized seizures seen in simple febrile seizures. If limited to a specific brain area, focal seizures occur, seen in complex febrile seizures. 5. Seizures manifestation. The child experiences involuntary muscle contractions, jerking movements, and possible loss of consciousness. Symptoms includes eye rolling, stiffening, rhythmic shaking, and postictal drowsiness. 6. Self termination of seizures. Most febrile seizures last less than 5 minutes and stop spontaneously as brain inhibitory mechanisms, example GABAergic activity. Region control. 7. Postictal pace recovery. After the seizure ends, the child may appear confused, drowsy. No permanent brain damage occurs in simple febrile seizures, though there may be a brief period of lethargy. 8. Potential recurrence. If fever persists or rises again rapidly, another seizures may occur, especially in children with genetic predisposition. This step by step breakdown explains how fever leads to febrile seizures and why young children are particularly vulnerable. Signs and symptoms. 1. Sudden loss of consciousness. 2. Rhythmic jerking of limbs. 3. Stiffening of the body. 4. Rolling back of eyes. 5. Drooling or foaming at the mouth. 6. Postictal drowsiness, confusion or sleepiness after seizures. Diagnosis. 1. Clinical assessment based on fever and seizures characteristics. 2. Lumbar puncture if meningitis is suspected. 3. Electroencephalogram not usually required but done in prolonged cases. 4. Neuroimaging CT MRI if focal seizures or neurological abnormalities exist. 5. Blood test to rule out metabolic imbalances. Nursing diagnosis. 1. Risk for injury related to seizures activity. 2. Ineffective thermoregulation related to fever. 3. Anxiety. Parental related to fear of recurrent seizures. 4. Risk for aspiration due to altered consciousness. 5. Deficient knowledge related to seizure management. Disease management. 1. Antipyretics, paracetamol, ibuprofen to control fever. 2. Benzodiazepines for prolonged seizures. 3. Anticonvulsants rarely needed only in recurrent or complex cases. 4. Treating the underlying infections. Nursing management. 1. During the seizures, A. Place a child on a safe surface. B. Turn the children to the side to prevent choking. C. Do not restrain movements. D. Do not put anything in the mouth. E. Observe and document seizures duration. B. Post seizure care. 1. Monitor vital signs and consciousness level. 2. Reassure parents and provide education. 3. Check for signs of neurological defects. Treatment options. 1. Supportive care, hydration, rest and fever control. 2. Medications, diazepam if prolonged seizure. 3. Hospitalization if seizures is prolonged or recurrent. 4. Home management plan, educating parents on fever management. Psychosocial medicine. 1. Parental counseling, educate about febrile seizures and reassure them. 2. Support groups, connect parents with others for shared experiences. 3. Stress management techniques, relaxation exercises for caregivers. 4. Community awareness programs, teaching caregivers and teachers. 5. School support, inform teachers about emergency seizures care. Prevention. 1. Prompt treatment of fever. 2. Regular hydration and rest during illness. 3. Avoidance of overheating in children. 4. Genetic counseling for families with a history of febrile seizures. 5. Vaccination as per schedule to prevent infections. In counseling, febrile seizures are common and generally harmless, though they can be frightening. Proper education, fever management, and supportive care can reduce parental anxiety and ensure child safety. While most cases do not require long term treatment, monitoring for recurrent seizures is important. Thank you. Have a nice day.